Namaste, myself Dr. Mrityunjay Swami, Managing Director of Shathayu Ayurveda. Today I am speaking about migraine. You might be knowing so many people suffer with migraine. In spite of doing so many tests, none of the tests will prove that it is a headache is like because of this particular reason. But still they will be having a unbearable pain. Especially what happens when it comes to the ladies. You see a lot of household people, they think that they are doing drama to avoid their household work. But actually that's not true. Migraine, in none of the reports, whether it's a blood report, scanning, whether it's a just simple X-ray or MRI or CT scan, everything will be normal, but they will get an unbearable pain. Then you may be wondering, how we will diagnose that migraine then? That's what I'm doing this program, to educate you people how you can find out that it's exactly migraine. In spite of doing all those tests, when you are getting a headache, how to differentiate between a regular headache and the migraine headache. That's what I'll be educating you now. So in migraine headache, usually what happens, you get headache either one side, or but some cases, in sometimes it may happen to both the side. But usually it has a typical characteristic of getting one-sided headache. Along with that one symptom, second symptom, very important one is, when you get a migraine headache, you will get a photophobia. You can't see the light. The moment you get headache, you feel like just closing the door and just want to rest there. So it's a second symptom, but that you can't see the light. And third most important one is phonophobia. That means you can't hear the sound. If somebody making noise when you get headache, you will get so irritated, you just want to hit them, or you just want to run away, or put some cotton in the ear, or you want to sit in a closed room, dark room, so that it will subside. These are the three very important ones. One side headache, or sometimes it may come both the side. Second one is you can't see light. The third one is you can't hear sound. The fourth one, very, very important one is, when you get this migraine headache, you may get a nauseatic feeling, like you may get a vomiting sensation. Some people, they get vomiting also. And you see whoever has a migraine, if they vomit, the migraine symptoms comes down. So these are the four. If you have any of the symptoms, any 2 or 3 symptoms, then it's 100% migraine. So you need not worry. Even if your MRI, CT scan or X-ray, blood reports, anything is showing everything is normal, but still you have a headache, and if you have these 4 symptoms, then you have a migraine. Along with these 4, fifth one is very, very important and very crucial is, once migraine comes, it will be there from 4 hours to 4 days. If your headache, it sustains from 4 hours to 48 hours, or for example, it's around 2 days to 3 days, then it is migraine. So usually you see, you won't even need whether it's coming in the morning, afternoon, evening or night. Whenever it's coming, if it is there between 4 hours to 4 days, then it is 100% migraine. So these 5 symptoms if you have, it is migraine. Then now let us understand why migraine comes. You might have seen, whoever get the migraine, you see they can't take these strong perfumes. The smell of this agarbatti also will trigger their migraine. And the second very important one is, if they are going for a travel, you see that the moment the journey starts, they will get the headache. And third one is, if they are not taking timely food, even if they skip for half an hour to 45 minutes, migraine triggers. So these are triggering factors for migraine. And if these 3 also matching to your this one, then it's a 100% migraine. So let us understand then why migraine comes. You might have seen majority of the cases, they give a lot of painkillers. Even in Ayurveda, you might have seen, they will say that it's ardhava bedaka, means half side headache. They will give that medicine, but still you won't get the relief. Then what we are doing in Shathayu? That's a uniqueness what we have got. See, first let us understand why migraine comes. See, migraine comes in body whenever there is an acid-alkali imbalance in the blood. The moment acidic level goes up, you get a migraine. So that's why you see when you are taking repeated painkiller, that again releases the gastric juice in the stomach, again it is increasing the acidic level. So the same painkiller is reducing the pain, along with it is again sowing the seed for next migraine attack. So similarly it happens like that, because there is no medicine for migraine in any of the system what we have noticed. But what we found out, the moment we are balancing the acid-alkali imbalance, the migraine is disappearing. And that too, we have got hardly 4 months medication. If you take that 4-month medicine, in lifetime you will never get a headache, especially migraine headache. That kind of a evidence what we have established in Shathayu. Because we are treating migraine since 125 years and we have treated almost, I am only practicing since 27 years. More than 24-25 years back also, whomever I treated migraine, till today they never got migraine back. So that kind of a treatment is there. What you need to do if you have a migraine, see, because none of the reports are suggesting it's a migraine. If you have a symptoms, the number which is displaying on the screen, just take a phone call and fix up the online consultation. Our doctors will first guide you, because in Ayurveda, diagnosis of disease is very, very important. If you are unable to diagnose, then treatment goes wrong. That's why once they do online consultation, they will suggest you whether you have a migraine or not. If you have a migraine, then what kind of a treatment we are giving, what kind of a lifestyle adoption you have to do, what kind of a diet changes you have to do, everything they will explain you. Because in migraine, the moment you are doing a fasting, you are not eating in time, if you are not taking a high protein food, you will get a migraine triggering thing. Especially tea, coffee, tannin and caffeine, they are like chemicals. They will increase the again acidic level in the body. It may give a pain relief. When you are getting a migraine, if you drink a cup of hot tea or coffee, migraine symptoms may come down. But that again causes the acidic level to shoot up. That again causes the migraine. So this kind of a, when the acid-alkali imbalance is happening, until and unless we balance it, it never goes off. Usually when we give a 4 months treatment, first 1.5 month, you will get a similar kind of attacks, headache attacks. Because we don't have a medicine for pain killing. We are balancing your acid-alkali imbalance. So it takes time, around 45 days to 60 days. Once that is settled, then your migraine symptoms starts coming down. Then you may not get a migraine attacks. Then you may not need a painkillers. So similar kind of a treatment goes for just 4 months. After 4 months, we never give the medicine. So if you are suffering with the migraine, don't need to be panic. Just do an online consultation. We so many times you need not come to our place, because we have 15 clinics spread across Bangalore and we have one of its retreat next to Bangalore International Airport, where you will get a lot of health insurance coverage. So you can come and stay and take the treatment. So it will de-stress, rejuvenate, detox, everything it will happen. So that also you can do. If you can't come to Bangalore and take treatment, just do an online consultation. We send the medicine to you. I hope this made any sense to you. If you are suffering with the migraine, just one phone call will get rid of your migraine headache. Thank you.